Okay, thank you, Rabbi Kornfeld. Appreciate you coming out tonight. Thank you for everyone. Thank you, Rabbi Haber. Thank you for everyone for joining us tonight. We're going to keep it fairly short because I know everyone's busy. But I guess what we're here to talk about tonight is this topic of internet addiction, right? Internet addiction, specifically, we're talking about the problematic stuff on the internet, right? We're not talking about Facebook addiction, right, and checking the sports. That is its own addiction, and I think that that's a real problem, but that's not what we're talking about tonight, okay? The issue that we're talking about, I think you could argue, is maybe even a much more serious addiction, something that I think our survival, I think like Rav Kornfeld says, our survival, Rav Tursky, Rabbi Abraham Tursky, right, who writes a lot on addiction, talks about how this is the big challenge, really, of our generation. And there's never been a time in history where people have had this kind of a challenge before. It's also something which, I don't know how many people in here, I know there's people here from all different, areas. Some people are, Rabbanim of Shul, some people are involved in yeshivas. If you're working with young people, you probably know already that this issue is huge. This issue is huge, and it's everywhere, right? And I think that there's, again, depending on how involved you are with young men, you may or may not know that this issue, it is across the board. I'm saying it affects everyone from, people who are not from, who are Jewish, not Jewish. This is not a religious issue per se. I mean, it's a religious issue as well, but this issue is sort of an equal opportunity offender in that anyone is at risk for this. Anyone who has contact with the internet, and you don't have to have internet in your own home. You don't even have to have a smartphone. Everyone is in some way exposed to this risk here. So just to tell you a little bit about myself. I was, after I got my master's in science, in social work, from Columbia, I went and I worked in a few different jobs. I found myself working at YU in the counseling center. And while I was at YU, I realized that a lot of young men had issues with pornography, right? At that point, it was just pornography that I was hearing about, okay? And when these guys were coming in, they were telling me that they could not have a normal life, right? It was completely getting in the way of being able to study, being able to sleep, being able to meet and date women. It was completely getting in the way of what was going on. And not only that, it wasn't always coming from a place which is, we would think, where, let me rephrase it. When I spoke to other people on staff about what was going on, other people who were more senior, they said, well, this is a normal part of growing up. This is a normal part, this sort of age appropriate, or there's experimentation, that kind of a thing. You should tell these guys not to worry about it. Tell them it's normal. I still remember the words they said. Don't be so frum. Or no, tell them not to be so frum. Tell them it's okay. It's something. It's a phase. What they didn't understand is that what is out there now on the internet, there is no precedent for this in the history of mankind. In other words, there has been pornography. And I'm sorry, I'm going to try and speak Belashin Naki as much as possible, but certain things, and I'm not going to be explicit or anything like that, but there's certain things I just need to be able to say what we're talking about. There has never been something like it is now in terms of the addictive nature of what's out there now, of internet pornography. There's been research done, it's called a supernormal stimulus, right? In other words, they say that, like junk food, for example, right? Food scientists have been able to engineer food in such a way that you can want to eat it even when you're full, right? In other words, you're satiated, but you still want to eat the bag of chips or the ice cream or whatever it is, because there's a way to sort of override the natural threshold that we have where we normally would be satiated. So the same thing with internet pornography. That, in other words, when it comes to normal between men and women, right, there's a certain amount of stimulation that a person needs until they're satiated. When it comes to pornography, it overrides that natural threshold of satiation, and a person just wants more and more and more and more, right? So we've never had something like this. And with pornography, with the internet rather, we now have access in a way that we never have had, right? In the past, if you wanted to access this stuff, you had to go to, some part of town where no one would recognize you, probably an unsavory part of town. You had to spend however much money it cost to buy the different stuff. Maybe you had to go to an adult bookstore or whatever it was, even to a convenience store or whatever. And then you had to risk getting seen. You had to deal with the cost, right? And then you had to sort of schlep to go get it. So those three things are now have been completely wiped away. They're no longer an issue, right? It's called the AAA engine, which has sort of made this thing really take off, which is accessibility, affordability, and anonymity. Now with the internet, you have all three of those things. You can look at as much schmutz as you want from the comfort of your own home. No one has to know. In fact, you don't even have to have a computer. As long as you have a smartphone, you can do it wherever you want. And so it's unprecedented the access that we have now today, unfortunately. So getting back to YU, so I spoke to them and I was talking about it, and guys were telling me they weren't even doing this because they were necessarily sexually motivated. They said they would find themselves doing it when they were angry. They would find they were doing it when they were tired, when they were anxious, when they were feeling lonely, right? And you see, it's separated from a sexual drive. In other words, it's not even a sexual drive that's leading them to get hooked on these things. So when I realized that there was very little understanding at the time, I decided that I wanted to really learn as much as I could about this, to get specialized training. And when I started my private practice in 2010, it was specifically with this idea. This is what we were going to be focusing on. In fact, I remember I went to Dr. Pelkovitz, who some of you may know of in America, the well-known psychologist, from psychologists. And I said, do you think I could have a private practice just doing pornography addiction? Because again, at that point, I was really only thinking in terms of pornography. And he said, I don't think so. He said, I don't think you'd have enough business. He was mistaken. I mean, he said, yeah, I think you have to do couples therapy and this other stuff too. When I was in New York, I opened up a place called the New York Sexual Addiction Center. I had an office in Midtown Manhattan. And there were days when I had more than 5 people calling in one day. A typical week, I had, I'd say, between 5 and 15 people calling every week looking for help. Now, obviously, I didn't work with all of them, and I didn't take insurance and all this stuff. Not everyone who called me I could work with, but this problem is huge. This problem is huge. I took a course, again, when I was in private practice in Manhattan for entrepreneurs. That was something, if people with small businesses. In Manhattan, and it was for people who were starting all kinds of businesses. There were 30 people in the class. It was 23 women and 7 men. And I think we met only about, I think it was like 7 times or something like that, or once a week. During the course of that class, so everyone had to go around and say what they did. During the course of those few weeks, 3 different women came up to me and confided that either their husband or their boyfriend had this problem. Now this is going back now, this is 2010. So I was like, wow, if there's, in this small cross-section of women, if they're coming to me, they don't even know me at all, right? And they're the ones who feel comfortable just to share it with a stranger. Imagine how many other women in this class, in this small subsection, their husbands have the issue, and they don't want to tell me. And then imagine, on top of that, the husbands who may have the issue and the wives don't know about it yet, right? So, again, that's just a very small section, a cross-section to show that it affects lots of people. And when I was in New York, I had clients who were very well-known personalities and rabbanim in the Jewish world as well. And we're talking about, I had people from the whole spectrum. It's not a modern problem. It's not a Hasidish problem. It's not a Litvish problem. It's an everybody problem. And I'm saying I had people from all different walks of life. And I guess, again, if you're not familiar, if you're not really in the trenches, or if you're not really seeing people with this issue, you may not realize how big of an issue this is. I hesitate to say that everyone has this problem, right? Now, obviously, not everyone has this problem, but it's very, very big. Okay. All right. So let's first just define what we're talking about when we're talking about sexual addiction. Okay. First of all, pornography addiction is a subset of sexual addiction. In other words, some people, they like to sort of separate the two and say pornography addiction is really something different. Pornography addiction is actually just one sort of type of sexual addiction, and we often see in sexual addiction that that's one area that people are using to act out. But there are other areas that people act out in, including meeting with people that they meet online. And again, without getting too specific here, just because of the crowd, I don't know really if I need to get too specific. But there's it's not just people accessing images. It's chat rooms, obviously. It's also finding people in real life. It's finding people, not strangers, to act out with. It's finding people that to pay to act out with. And the internet has completely changed, again, what this was like before. Imagine before someone had a taiva to go and act out with someone. Well, where am I going to find someone, right? Especially me, I'm a nice frum guy. I live in RBS, right? How in the world am I going to find someone who's willing to, to act out with me? If I have an app on my phone, I can find it in seconds, in minutes. And these apps measure how far someone is in meters, like how many meters away they are from me, right? So, I mean, when you think about that, there's never been anything like that in the past. And again, we have to realize, as rabbis and community leaders, people in our shul have access, and in our yeshivas, in our batei medrash, have access to these apps, right? We don't know what apps people have on their phone, right? I'm saying we're not going to ask them either, but it's in a way that we never would have dreamed. The access is a way that we've never would have dreamed. So getting back into this definition of sexual addiction, so it's a recurrent pattern of unwanted sexual behavior that tends to escalate over time. Okay, so just to repeat that, a recurrent pattern of unwanted sexual behaviors, including looking at pornography, among others, that tends to escalate over time. Okay. By the way, I'm going to email anyone who wants. I will email you the notes from today, just so you have access to this. Okay. So if you don't have paper or whatever, I can email you the notes. Okay. And one of the hallmarks of addiction is that the addict can't stop, even if there are negative consequences. Right. So think of an alcoholic who gets arrested for driving drunk, right? So any sensible person, right, once you get arrested and you go to court and maybe you go to jail, who knows what, right, would think, oh my gosh, I can never drink again, right? But the nature of an addiction, right, the nature of an addiction is that you can't stop, right? So the same thing here. I've worked with clients who have lost their marriage and they still can't stop. And they've lost 2 marriages and they still can't stop. People who have been arrested because of the behavior, and they still can't stop, right? So that's one of the important aspects of an addiction, what makes it an addiction. Okay, another very important point about addiction is it's a chronic disease. Okay, addiction is a chronic disease. Again, like alcoholism or drug addiction, if someone is truly addicted, and not everyone who looks at porn is addicted, not everyone who has an affair is addicted, right? Just like not everyone who gets drunk on Simchas Torah or Purim is an alcoholic, right? We all know that, right? But if someone is truly addicted, the way we understand addiction, it's a chronic disease. There's no cure, okay? I like to compare it to diabetes, right? If someone has diabetes, and I guess type 1 diabetes, right? If we want to be specific. If someone has diabetes, there is nothing they can do to make the diabetes go away, right? What they can do is they can take their insulin, and they know that there's certain foods that they need to avoid. Okay? And as long as they take their insulin and they avoid certain things, they can have a healthy, normal, productive life, right? But they have to respect the disease. They have to say, I have diabetes, and I know that if I do this, it's going to get me into trouble. Okay? So same thing with this, right? Now, when I say there's no cure, does that mean that someone needs to continue to suffer for years and years? Not necessarily. People who are addicted can become sober, right? I think everyone is familiar with this idea of addicts going to, let's say, 12-step meetings, that kind of thing, and they can get sober. And I'll talk about 12 steps at the end. Absolutely, they can get sober. But one thing to know about this addiction compared to drugs and alcohol, the consensus is drugs and alcohol are a much, much easier addiction to deal with than this addiction. food and sex are basically the hardest addictions to break, and that's because as human beings, we're wired to want these, or in the case of food, we need them, right? So someone can say, you know what, this alcohol, it's not worth it, I'm going to stop it, right? And they get help, and they can put the alcohol away. Same thing with drugs. With food and with sex, it is obviously much, much harder, right? Especially, as Jews, we don't recommend celibacy, right? We're not a religion, and certainly it's not a widespread idea, this idea that you're going to go and give up sex and live the life of a monk. That's not a Jewish idea, and it's certainly not something that's a Western idea either, right? So learning how to integrate that, how do I still stay sexual, but keep it under control, is much, much harder than giving it up completely, which you would with drugs and alcohol. Okay. All right. Another thing to understand about addiction is not the problem itself, right? And what do I mean by that? What I mean to say, the addiction is actually, it's a failed solution, right? Addiction is actually a symptom of something bigger, sort of like the tip of the iceberg, right? If someone is acting out, whether with drugs, with alcohol, with sex, with food, whatever it is, this is not the actual problem. This is a symptom of the problem. So if we try to sort of put a Band-Aid over it, right, we're not necessarily dealing with what's driving the addiction, okay? What is driving the addiction is, I like to say that sex addiction is not about sex, right? And this is sort of a bit of a surprise to people. I just like you'd say the same thing about porn, right? People who are looking at pornography, people who are acting out sexually, it's not about the porn, it's not about the sex. When people call me up, usually the very first phone call, I'd like to screen people over the phone before I decide if I can work with them. Very, very often, I'll ask and usually it's a man, but not always, what's going on, how's this happening? And usually, very often, the man will say to me, well, I have a much higher sex drive than other people, right? I hear that all the time. And, at that point, since we're not really working together yet, I just sort of say, okay, I hear you. But as we start to work, they say it's really not about that. Like those guys I was talking about, those college students who were using it as a way, the ones who were saying that they were looking at porn not because they were feeling sexual necessarily, they were angry, or they were scared, or they were sad or lonely. It's a way to medicate their feelings, right? So in that sense, it's like any other addiction, right? Saying that people act out sexually because they have a high sex drive is sort of saying that alcoholics are thirstier than other people, right? It's not true. It's not true. But if you ask someone who's in the throes of addiction, they'll tell you, well, I just happen to, it's actually not true. As they get a little bit more insight into what's driving them, they'll see that this is something that they're using, that they often learn when they're young, as a way to deal with life, right? Meaning life can be hard, right? All of us know that. Life can be very hard at times. What sex addicts learn at a young age is that being sexual in some shape or form can make the pain go away for a while. And this is the same reason why we have teenagers who are getting involved with drugs and alcohol, right? It's a way to deal with the pain of life, right? So that's a very important consideration. Again, and when we're dealing with treating people, if we're just talking about putting a filter on the device, filters are great, right? And we'll talk about filters in a minute and why they're necessary. But or moving, before there were smartphones, people would say, make sure that the computer is in a central room of your house, right? Don't leave the computer alone, right, in a separate room, so people could, I guess, have yichud, with the computer. Now, obviously, with a smartphone, you can have yichud with your device wherever you go, and it's not uncommon at all for my clients to hear. I've heard, and it's very common, to go into the bathroom, right? I'm saying that you could be at work, you could be in yeshiva, you could be at home, and you just take your device into the bathroom. No one in the world thinks that's a weird thing, but again, that's the idea here. Okay. All right. So we talked a little bit about what different types of behaviors we're talking about. Just want to say, sexual addiction is something different than sexual offending. Okay. People often think that they're the same thing. People who, let's say, victimize other people, like people who are rapists or people who take advantage of children, that does not necessarily have anything to do with an addictive process. Okay, that from a psychological point of view, that's really something more of an antisocial type of a behavior. It's about about looking for victims, right? It's more sociopathic. It's not about addiction, right? There can be an overlap there, but they really are two different things. All right, and the same thing with sexual abuse, right? So someone who has this issue, there's not necessarily any issue of sexual abuse. Okay, so one thing that I said I was going to talk about tonight was how do you know when it's addiction? How do you know when it's the yetzer hara, right? Because everyone has a yetzer hara, right? As I said before, everyone is created with this essential desire to be sexual, right? And I think, right, I probably should not mention this here because I'm in a room full of rabbis, but there's that Gemara about when the Chachamim they tried to daven for the yetzer hara to be taken away for sex, right? And it didn't work, right? It's something, it's part of human nature, right? So again, how do we know if it's yetzer hara or not? Everyone has a basic amount of curiosity, right? And as people grow up, there's definitely people are driven to experiment, that kind of a thing, right? But again, if we're looking at it more in terms of some of the hallmarks I mentioned before, not being able to stop even when it's causing you problems, right? It tends to escalate over time, right? No one believes that alcoholism is yetzer hara, right? No one thinks that drug abuse is yetzer hara, right? But when it comes to this, people get confused, and I think it's actually a very important distinction. Guard Your Eyes, right? I think probably most people in here have heard about Guard Your Eyes. I think it's a very important organization that has really done amazing things to raise awareness. But one major thing that I don't agree with them is that they confuse the two. In fact, if you go on their website, they absolutely say that this is yetzer hara, right? I think when I deal with my clients, I make sure to separate the two, right? And I say, look, there's no question this is an avera, right? Right? But I'm not a Rav, right? And you're not here. You didn't come to see me because you're looking for someone to tell you if it's asur or mutter, right? We all know that it's problematic from a halakhic point of view. But what we're talking about is a medical illness, right? Just like alcoholism is a medical illness, right? When again, a few generations ago, people did not look at alcoholics as they didn't look at this as a real type of a mental illness. They said people have, poor willpower, right, or some kind of it had more to do with character defects. We don't understand alcoholism or drug addiction today as having to do with a character defect. We understand it as I said, like a medical disease, right? That's the disease model of addiction, and it has to be treated as such. Okay. And again, if you guys have more questions about that, I'll take questions at the end. All right. So I guess this sort of begs the next question, which is, why do some people get addicted and not others, right? If everyone has the yetzer hara, why is it that some people get addicted to this and other people don't, right? You could say the same thing about alcohol, right? I'm saying on Purim, most people drink, right, in our community, right? Simchas Torah, a lot of people drink. Some people drink every Friday night. They have a few drinks, right? Or Shabbos morning at the Kiddush. Why doesn't everyone get addicted? We don't know the answer to that question, right? And I think Rabbi Tversky, when he was here about a month ago, was asked that question. No one really knows that for sure. It seems to be a combination of a genetic predisposition. Addiction tends to run in families, and also people learn it as coping mechanisms growing up in families. One thing specifically about sexual addiction, there are certain things about people's childhood which seem to predispose them to becoming addicted to sex or pornography. If you look at something about 90% of sex addicts had in their childhood either significant physical abuse, sexual abuse, or verbal abuse, which again is a pretty shocking statistic. And there's a very heavy aspect of childhood trauma making someone vulnerable to getting hooked for this. Again, because like we said, it's not really about the sex. It's not about the porn. It's about this inability to deal with pain, right? And someone who is getting physically abused, sexually abused, verbally abused, right? And again, it doesn't even have to be the obvious kind, right? When I tell this to my clients, some people are like, oh yeah, I was molested by my uncle or something like that. And I go, oh yeah, I was beaten up by my mom or my older brother, whatever. And other people are like, I had a great childhood, like I never had anything wrong. When we look a little bit deeper, there are things which are more subtle. We call it like trauma with a small t instead of a big T, right? But they can be equally damaging, right? The person who mom and dad, never argued. I had a client who said, I never saw my mom and dad fight. But as we got to his entire life, which I'm like, is that even possible? It turns out mom and dad slept in 2 separate bedrooms and really had nothing to do with each other, right? So imagine growing up and seeing like that's your model of how to connect to people, and especially and your model of intimacy, right? There's none. You basically, it's just complete disconnection. And that is actually a very common, something that we see with families of the family of origin of sex addicts. They come from homes that are rigid and disconnected, right? Usually they have those two things in common. Rigid means a lot of rules and it's very strict. And second of all, it's very disconnected. Like people are not really in touch with each other. People are not really, they don't see that intimacy going on. Okay. All right, now you as rabbis and leaders of your community, how do you know if someone is addicted, right? Are there clear warning signs? So the answer is sometimes there are, right? Obviously, if you are the rabbi of a shul, you've dealt with people who have marriage problems, right? A lot of times people are having marriage problems. There is an issue of pornography. There's some statistic out there that something like 50% of all divorces that happen, pornography is part of the picture. That's part of it. I spoke to an attorney here in Ramat who deals with his specialty is divorce. I said, how many of your cases that you've worked with was pornography an issue? He said 100%. That's what he said. Okay, I don't know if he was being serious. He said all of them. Okay, I mean I find that statistic high, right? But again, I think this is a much bigger issue than we know. And I will often say to when other, we therapists, we have a little group of therapists who, we talk to each other, we send each other referrals and that kind of thing. People will sometimes go and post, I'm looking for someone who does anger management. And I say, I know this may sound crazy, but maybe someone needs to ask this guy if he's got an issue with pornography, right? Because if someone has this kind of a secret and is carrying around this kind of a shame, it may be completely unbeknownst to the wife, but this is going to have a big effect in the marriage. And if rabbis also are not looking at this, rabbis have a couple come into their office and they're fighting like cats and dogs, and this guy just does not seem to be willing to listen to what's going on, and he may be addicted, right? When someone is addicted to drugs or alcohol, usually the signs are easier to spot. Right? If someone's an alcoholic, people will see him in shul overdoing it. Right? People will, right, or his wife, or definitely people near him will see he's an alcoholic. Right? Same thing if he's a drug addict. It's going to affect his ability to perform at work or in other places. If someone's addicted to this, there may not be any symptoms whatsoever. Okay, so as I said, there may be clear symptoms. However, I've had plenty of addicts come in for therapy, and they seem to have very civil relationships with their wives. I was initially really surprised by that when I started working in this field. They actually seem to get along just fine, right? And some of them, they say that they're best friends with their partners, which again, I was sort of like, I don't get that. It's not necessarily a proof. So in other words, you need to be aware that even people who have good relationships may have this issue, okay? Again, we may think of people who are struggling with, the guy who can't find a job, right? Or the guy who can't get out of bed in the morning, or, these sort of people who seem to be struggling through life. We may say, okay, well, this is the guy. And again, it could be. But alternatively, when I was in Manhattan, I had my office in Midtown, and I had a pretty high fee that I charged. I got a very successful type of client. A lot of CEOs, a lot of millionaires. I had one billionaire. I'm working with someone now who owns an NHL hockey team. These are not people who are, can't get out of bed in the morning, and, these are not losers. You know what I'm saying? These are people who may be very successful in other areas of their life, but are struggling here. So again, you have to realize that anyone might have this issue as well. Okay, not just people who are struggling. A lot of times, the wife will look for help before the husband will, right? Especially, I found with these clients who are very successful or very wealthy, they often feel the sense of like, I can do whatever I want, and if my wife has a problem, but I should say it's not just wealthy people. But a lot of times, the women will look for help before the men will, right? Okay. Another warning sign, just again, you guys should know, if you have couples coming to you, and if you ask them about what their intimate life is like, right? It's not uncommon at all for some of my clients, people that come to see me with this issue, they have not been sexual with their wives for years. For years. So again, I don't know if this is something that rabbis are thinking of asking. Maybe it's not, they feel it's not their business. Maybe they feel it's not appropriate to be sort of probing in these areas. But again, this is something which is worth knowing. Because again, even the women themselves, they very often don't make a connection. They say, well, my husband's so busy with work, right? I had someone who said, well, my husband was abused. He was sexually abused as a kid, and that's why we haven't been sexual for years, right? Of course, she discovered that he was being very sexual with lots of women, just not with her, right? Okay. All right, and also, I don't know how much we see this in RBS, but also older singles. I think it's something also to look into with older singles, people who are, having trouble getting married, whether this might be part of the picture as well. Okay, there's a short screening test that might be helpful for you guys. Something to remember. It's with alcoholics. A long time ago, they came up with this little 4-letter acronym that they could ask clients to ask them if they had an issue, and they came up with something similar with people to see if they're addicted to sex, and it's called PATHOS, PATHOS. So if you have someone that you're dealing with, someone comes to you and they think they may have a problem, you can ask them these 6 questions. So P is preoccupied. Do you find yourself preoccupied or obsessed with sexual thoughts, right? A it stands for ashamed. Do you hide some of your sexual behavior from others, right? Do you feel a strong sense of shame because you're doing things that you shouldn't be doing sexually? T is therapy or treatment. Have you ever gone to seek treatment for these issues in the past? H, have you hurt others by your sexual behavior? O, do you feel out of control? Are you unable to stop these behaviors? And S, sad. Do you feel sad or depressed about your behaviors, especially after you do them? Okay, so that's the PATHOS screening test. And I think when they developed that for alcoholics, it helped family doctors to diagnose, or to screen for alcoholism in their patients. And I think that this also can be something helpful for rabbis to use, to sort of get a quick look to see if this is, how much of this is normal or innocent, I guess, sort of experimentation or dabbling, and how much of it is a sign of an addictive behavior. Okay, so now what should you as rabbis do if you discover that someone that you work with has this issue? Okay, so obviously there's basically we have 3 different scenarios of who should assess, right? So we have the rabbi doing the assessment. We have your regular therapist or counselor doing the assessment, and then the third one is someone who's trained in doing this. So obviously, everyone can be helpful on their level, right? Obviously, and rabbis, because they have access to people and people trust them, can absolutely help to get that started, right? But when it comes to something like this is a very new addiction. This whole addiction really didn't exist 20 years ago, right? Basically, it's only since the internet came out that this has been an issue. If most therapists today do not understand this at all, okay? In fact, there are therapists who really get this completely wrong, and surprisingly, some of those therapists are sex therapists, right? I'm not a sex therapist. Sex therapist, it's sort of an older kind of a way of dealing with these issues, and they actually even today, they actually promote pornography often. And I'm talking about in the frum world. There's some very well-known frum sex therapists here in Eretz Yisrael who actually, people come to them and they're having sexual problems with their wives, and the therapist will say, maybe you guys should start watching porn, right? Maybe that will help you to sort of get in touch with some of your with your own sexuality. You're too repressed. You need to loosen up. You need to, And by the way, and some therapists also will completely miss the boat here. And I've had this happen where people come to me after they've been to these other therapists, and they'll spend 2 years there and thousands of dollars, and they got the absolute worst advice, right? So, for example, a man has an issue looking at pornography. The wife has a problem with it, right? So they go to a therapist, and what does the therapist say? You, Mrs. Goldberg, you're the one with the problem. You're too uptight. You should join him. You should watch pornography together with him and learn to explore your own sexuality, right? So that's just wrong on so many levels, right? Besides the fact that halakhically, I have no idea how any rabbi could give a heter for someone to look at pornography. I don't know of any such actor. I'm very surprised that again, this is not my area of expertise. It's just sort of mind-boggling to me. But certainly, if someone walks in like I'm an alcoholic, well, you're probably not drinking enough, right? Maybe you need to try this kind of vodka. It's the worst advice. And of course, this woman thinks, well, wow, this is a professional, right? He's very well known. He seems to know what he's talking about, and this is what he's saying. Let's give it a try. And she goes along with it. The problem is this man is sick. He has a disease. It's not being addressed. Okay, so what I would encourage you guys to consider is to get this person. If you have ascertained through your talking with him that you think that there may be a problem with this, to make sure that this person sees someone who really understands this disease and someone who has training, because again, not everyone who bills himself as a sexual addiction therapist has any training whatsoever. And this is not just here in Israel, this is in America as well. You don't need any kind of credentials to say that you can treat this, right? And I know here in Israel there are people who their experience is that they've had this issue and maybe they went to 12-step meetings, so they feel that they're qualified to they struggle with this themselves. I don't believe that in itself is enough of a qualification. This is a very serious thing. It's progressive, right? The same way that drug addicts will eventually overdose, right? Because over time, the same little bit that used to be enough to get someone high in the past, it's not enough. They need a little bit more and a little bit more and a little bit more. The exact same thing happens with this, right? So people will start off with something relatively vanilla, right? We'll call it vanilla. Over time, it's not enough to get that same feeling, to get high, to get the same buzz. You need to keep adding more and more when it means more risk, more intensity, or more frequency, right? And over time, this is what will blow up a person. This will blow up a marriage. This will blow up a family, right? As you guys can imagine, the devastation that is caused to the wives and the kids is as you can imagine, it's huge. Okay. All right. So, what does the assessment look like? The assessment is going to basically sort of look for any other sort of comorbid problems: depression, anxiety, ADHD, PTSD, OCD, all these initials, right? ABC, BBC, all these initials, right? To see if that's going on. Now, one taina against sex addiction as a phenomenon is that it's not really a real addiction. It's actually something else, some other mental problem that's manifesting as sexual acting out, right? So, for example, maybe someone's really depressed, and that's why they're acting out, right? Or maybe this one to me is the most silly is OCD, right? Especially because I think I've had maybe one or two clients total who have OCD, but that this is some kind of an OCD, and that the main issue is OCD. You need to treat the OCD. The problem is when you treat those other issues, the addiction does not go away. That is, I've never seen that happen. In other words, if someone, it is very common that people have other underlying issues, right? There are plenty of sex addicts who are also depressed or have issues with anxiety or ADHD. Plenty. And you absolutely need to treat those. But when you treat those things, it does not make the addiction, according to that theory, it should lift, right? So if I give someone antidepressants and they're getting the best kind of therapy to help them and they feel less depressed, they should stop acting out if that were true. It doesn't work that way. It's, like I said, this is something which people learn at a young age, and as a coping mechanism, it's how they deal with life. So you need to deal with that coping mechanism, not just the other issues. One rabbi, when I said we're doing this, he said he wanted to know what's the role of medication, right? So a psychiatric evaluation is definitely appropriate sometimes, right? If someone comes in and they're clearly showing some signs of depression or anxiety or other things, I will absolutely send them to a psychiatrist, and they should be treated, right? And a lot of times, especially you have adults, a lot of guys who have this issue, they may have been depressed for 20 years and not know it because they've been medicating this way, right? Or they may have really bad issues with anxiety, but this is how they've kept the anxiety at bay, right? And the same thing with adults with ADHD. A lot of these guys never got caught or, by the system because, again, who was talking about ADHD 30 years ago, right? It's a much more recent phenomenon. So a A psychiatrist should evaluate when it's necessary, and those issues should be medicated. As far as medicating the addiction or the sex drive, I think is actually a very bad idea. I've had some people tell me that they know people who went to see that the psychiatrist gave them chemical castration, they do for like sex offenders, right? Because they could not deal with their sexual impulses, and they were getting medication to basically, or to stop the production of testosterone. I think this is terrible. I think this is really harmful. And worst of all, it doesn't address the underlying issue. As I said before, this is about a way to cope with life. A person needs to learn how to cope with life, and a person needs to learn how to connect with other people. If they don't learn those things, these behaviors will not go away, right? Or actually, they certainly will not be resolved. And you can help people to learn how to deal with, to cope with life, and to have deeper connections with other people. Okay. Let's see. There's different sort of assessments. There's certain written testing that we do as well. Okay. Talking just for a minute here about different types of treatment. Okay. When an assessment is made, right, and the assessment is like I said, it's ruling out those other issues. They're seeing if there are other comorbid mental illness issues like depression, anxiety, OCD, PTSD, all that stuff. Also looking out for other addictions, because very often people who have this issue have other addictions as well. What I've seen big from people in my office, not always, but the most common one I've seen from people is overeating, right? Those two go hand in hand. In other words, very often, and it often usually correlates to what type of acting out someone is doing. Someone who is more likely to have an issue with pornography and masturbation is also very often, or there's a correlation, I should say, with overeating, right? And unfortunately, I think in the frum world, I'm not sure why this is, but obesity seems to be an issue that's not really being addressed, right? And it seems like almost like okay for people to be obese in the frum world. I don't really understand that, but what's similar between pornography and masturbation and overeating is that both of these are numbing behaviors, right? What these things do, they help a person to sort of basically numb the pain. It kills the pain. That's the idea. Whereas someone who is paying for sex, someone's going to prostitutes, are more likely to see a different type of drug use, something like cocaine. People are looking to get high, right? Which is, again, it's a very different picture, requires a different type of treatment, right? And then also we're going to have to go into their childhood and see what kind of childhood trauma there was there and what sort of wounds they're still carrying around from childhood. And again, a lot of people, they get into treatment, they're like, well, what happened to me 30 years ago have anything to do with what's going on now, right? I just want to stop doing this now, right? I don't care about the fact that, my mom was mean to me or something like that. What does that have to do, right? And so part of the process is explaining to them how, this trauma tends to stay with people and it informs every decision that we make, right? Someone who had these traumatic experiences growing up will still see the world through those set of eyes that they had when they were a child, right? The world is still a very scary place for them. Okay, so once we've made the assessment and we've diagnosed that someone actually has this addiction and they're not just a casual user, right? So basically there's 3 different types of treatment we can offer them. So one is outpatient, right? Outpatient is basically you go into your therapist once a week, right? I also have my clients go to a group once a week in addition. So they're doing one individual session a week and one group session once a week. Group is fantastic. It's so important because it helps people to deal with the shame, right? A lot of times people think they're the only person in the world who has this issue, or their entire lives they've been carefully guarding the secret that only they know about, right? Everyone else thinks that, they're this great, upstanding citizen. Meanwhile, they know this really horrible secret about themselves. Group can really help people to deal with that shame, to sort of let it go, and to connect with other people who are struggling with the same thing in a way that's very helpful. That's outpatient therapy. That's for the least sick. So in other words, I'm not saying people aren't addicted, but this is the lowest level. The highest level is rehab, right? And again, this is something which still, in the media, there's still this sort of, I think in the general culture, this idea of like, is it really an addiction? Someone's going to rehab for sex addiction? Like, isn't it just an excuse? Like, now, like here they went and they caused all this trouble by acting out. Now they get to go and ride around on a horse and a ranch and, and get massages and sit and do group. That's going to make them better. Sometimes people need to be in that kind of a setting. That setting, Instead of doing 1 or 2 hours of therapy a week, you're basically doing therapy from when you wake up in the morning until you go to sleep at night. And, and they take away your phone, they take away your computer access. Sometimes people, and it's for a much longer period of time. Sometimes people really need that, depending on how sick they are. And one thing which I think is really amazing, which is something that really they only use in the world of addictions. It's not really popular in therapy outside of addictions. It's in between the two. It's called intensive outpatient. And this is, I've really seen some really phenomenal things with this. When sometimes people need more than once a week or twice a week, but they don't need to go to rehab, which they could be there for, anywhere from 1 month to 6 months. So an intensive outpatient is basically somewhere between 1 week to 2 weeks, where you're doing therapy every day from like 9 till 5. You go home back to your house, at night, or sometimes people. I've had clients fly in from America, and they'll come and they'll stay here. They have a place to stay at night in a guest house, whatever. They're doing therapy all day for 1 or 2 weeks. And what can happen? You can basically do like a year's worth of therapy in 1 week, right? Imagine like if someone, has strep throat and they need antibiotics, right? And so you have to give it to them twice a day for a week. Imagine if you space that dose out, once every 2 days instead of, having 6 doses in 2 days, right? The person's not going to get better, right? When it's something really very pervasive like addiction is, it affects every single decision you make. It affects the way that you look at your spouse. It affects the way you look at yourself. It affects the way you look at God. How are you going to get better giving this person an hour or 2 of therapy a week when they can have a great session, they walk out of the office, and it's like, as soon as that stress comes back, right? So their wife calls them up, Jimmy got in trouble at school. I guess not too many Jimmys here in the community, but Shimmy's in trouble. You better come home, or your boss is like, you better get over here. This project, and it's like, oh great, now I have to deal with this again. It's not really. Sometimes people need more time. So this intensive outpatient is really an excellent choice, I think. Okay, let me talk a little bit about 12 steps. Actually, before I do that, I just want to answer the question. So does treatment work, right? So as we said before, the way we look at addiction, it's a chronic disease. There's no cure. However, people can and absolutely do get better. It is a lot of hard work, and it's a long haul, right? According to Dr. Patrick Carnes, who was my teacher and is considered the world's leading authority in sexual addiction treatment, he was talking about this stuff 30 years ago when everyone thought he was nuts, and before there was an internet, and people were saying like there's just no such thing, and then the internet popped up, and all of a sudden people were like, oh, he's a genius. So he says that on average, to sort of reset, for a person to really recover from this addiction, is on average 3 to 5 years, right? So that's something which, again, people when they get in treatment, they don't like to hear that. They want to they want to be fixed in a few weeks, a few months. It takes a while. There's just no way around that, unfortunately. There are no quick fixes, right? And again, some people may say, use hypnosis or this and that. I don't know of anything that works. Most people who are getting into treatment, even if they're in their 20s, this has been an issue for 10, 15 years. Guys who are coming in, I have a client right now who's 75 years old. He's 75 years old, and he just got into treatment because his wife caught him again, right? And the first time he's been in treatment. People have this issue for 20, 30, 40, 50. I'm saying this guy probably had it for 60 years. So to think that you have this issue for 30, 40 years, whatever, and all of a sudden, you want me to fix you in 3 months, we can make some, we can start the journey, but this is going to take a while. Right? Okay. All right, let me talk a little about 12-step meetings. 12 steps, again, I think Rabbi Twersky has done a tremendous amount in making 12 steps kosher for the frum world. Especially in America, most 12-step meetings are in church basements, and there's definitely this idea that, how is it mutter for someone to go to a meeting? Rabbi Twersky talks about that, and obviously, poskim, talk about whether that's, whether it's okay. Fortunately, we don't have that issue here in Israel, right? We do have 12-step meetings, and the original one was Alcoholics Anonymous, and there are 12-step meetings for sex. There's actually 5 different ones. The one that frum people tend to gravitate towards is called Sexaholics Anonymous, or SA. I think that there's some really wonderful aspects of SA. I recommend all of my clients to do 12-step work. And the focus of 12 steps is spiritual, right? It's all about God. It's all about higher power. And this idea that the way to cure these issues is by looking for a spiritual solution, which I think is absolutely true. I think there's absolutely this. We talked about this, people looking for a coping mechanism. This idea that there's a void that people are trying to fill. I think whether you approach it from a psychological point of view or spiritual point of view, there's absolutely a void that people are trying to fill. In the 12 steps, they're focusing on getting that higher power or God to fill that void for you. So like I said, I think it's great. I recommend it. I don't think it's a substitute for therapy, and I'll tell you why. And by the way, some people in the 12-step meetings are very gung-ho about this idea that you don't need therapy. Therapy is a waste of time. It's a waste of money. All you need is your higher power. I think that's great in theory. But, these things like childhood trauma that we talked about, right? A lot of these sort of psychological issues, the cognitive issues, the emotional issues, aren't necessarily going to be dealt with in a 12-step meeting, right? A 12-step meeting is you have a bunch of guys. There's no professionals there. They're all addicts in recovery, right? And to go to a meeting, you could be in recovery for one day or for 20 years, and there's no leadership in that sense. You're supposed to get a sponsor. You're supposed to choose a sponsor who is more sober than you, can help guide you through the steps. But again, there's people are as accountable as they want to be in 12 steps, and you can fall through the cracks very easily. You can show up for meetings for years and years and not get any better. And there's no one really there to be like, hey, what's going on? Because everyone's kind of doing their own thing. So I think it's great, but I see it as an adjunct to therapy. Okay. Just talk for a minute about prevention on a personal level and a communal level, and then we'll take whatever questions you have. Okay. So I think when it comes for protecting yourself, protecting your family, protecting your shuls or your kehilas, I think we need to talk about this issue, right? When it comes to, I think there's this idea that we don't want to talk about it because we don't want to give people ideas. Well, also on top of that, maybe we're uncomfortable with it, right? It's not something that's so appropriate to talk about. When I was coming up with this lecture, I was really going back and forth. What can I say? What can I not say? I really want to be careful, what I talk about, what I don't. And certainly rabbis also need to be, that's a consideration for rabbis as well. But the same way that we talk to our kids about playing with matches, right? We don't wait for our kids. We don't say, look, if we talk to our kids about playing with matches, that's going to give them an idea, and they're going to get matches, they're going to start playing with it, right? No one thinks like that, right? At least I've never heard of anyone who thinks that. Everyone thinks, I need to tell my kid, this is fire. If you put your finger in it, you're going to get burnt, right? You don't wait for the kid to do it, right? The same thing here, right? And I don't think that because people tell their kids, don't play with matches, kids, run to their room and start playing with matches, right? There is a natural temptation here. And anyone who has a connection to the internet, and it doesn't have to be yours, it could be, if you don't have internet at home and you don't have a smartphone, your neighbor very well might, or the neighbor's kid, or someone in school, right? And I think that unfortunately, it would be great if you knew that this school, whatever school you sent to, right, you would never have to worry about your kids being exposed to this kind of stuff. Unfortunately, it's just not the case, right? And these days, internet is everywhere in some shape and form, right? So I do think that it's really helpful to talk to our kids about it. I think it's important to talk to our kehilas about it, again, proactively, right? And I think that husbands and wives should talk about it also. I think, again, they're saying a lot of men, I don't think, are going to want to initiate the conversation, but I think usually it's the women who want to initiate it. But I think it's a conversation that's better that we have it before it's an issue than it has to be. Obviously, if you're talking to kids, it needs to be in a way that's age appropriate. You do need to also deal with this issue, like I said, with friends, right? I'm saying in my house, all the devices that we have the kids can't get on them unless we let them on because everything has a password. And then even then, it only lets them use certain apps which I have, handpicked, right? And I can put a timer on it. They use for half an hour a day, something like that, right? But what if the kid upstairs from me, his parents let him on the phone all the time and they could be intelligent people and they could be otherwise, sensitive from people who just don't get. They think my kid would never, why do I have to be? My kid's 8 years old. I have to worry about my kid looking at stuff, right? The statistics are most kids who find pornography online do it by accident, right? And they usually find it by age 10 or something like that. Really disturbing statistics. I didn't bring a lot of statistics today, but I think we all know, but maybe we don't. Just that this issue is really everywhere, and we really need to be very mindful, and it can happen to everyone, not just the bad kids, not just the kids whose parents are, sort of checked out. Even, very, very from families, very good families. Unfortunately, this is an issue for everyone, okay? The last word about filtering. Okay, I mentioned before that filtering is sort of putting a Band-Aid on it. That being said, I think that absolutely everyone needs a filter on all their devices, right? So that means desktop computers, laptop computers, iPads, tablets, and for sure smartphones, right? And I don't know that many people. Baruch Hashem, I think in this crowd, I think there's maybe more people who are more attuned to this, who have filters on their phone. If you have a smartphone at home and you don't have a filter on it, it is. I mean, would you leave a stack of pornographic magazines, and then on the dining room table, when you go to bed at night, and just assume that nothing's going to happen? I like to say that having not having a filter on your internet is a little bit like people who are alcoholics. You can't have, if you have a liquor cabinet in your house, it absolutely needs to be locked, okay? And you can't have the key, right? That basically, this is the equivalent of an open liquor cabinet. I mean, if there's no, there is, and it's not just you, it's other people in your family. But it's something that absolutely filtering is essential for everyone. This is not a frum thing. This is not a Haredi thing or a modern thing or what. This is for everybody. This is for everyone. Okay. All right, and I can recommend some specific filters that I like. I like NetNanny is the one that I recommend for laptops and desktops. For phones, there's one called MobiSip, which is also very good. There's one that's been developed, I think, by from people here in Petah Tikva called NetSpark. And I actually spoke to someone, that was you, hi, who said that, Rabbi Hartstein, right? Who said that actually your whole yeshiva now, everyone's required to have NetSpark, which I think is amazing, and I think is an inspiration. And I think that everyone should really, I couldn't believe that you got the kids to agree to this, but I guess when yeshiva is serious and it sets a policy like that, there's a very clear message, right? And I think it's not enough to rely on people's best intentions. When I was at YU, I had some back and forth with the administration there over how big an issue it was, and people did not think this was an issue. I remember years after I left, I saw in the news that YU, it was like in the news, that YU put a school-wide filter on the internet. And I said, no one is immune. I'm saying, unfortunately, and we need to be responsible, right? This idea that it's sort of like people will just discover things on their own, or they'll self-censor or self-regulate. Unfortunately, it doesn't work like that. So that's it for my lecture. If anyone has any questions, we'll open up to questions. Okay? And if you have to go, please feel free to go. Thank you all for coming. Really appreciate everyone coming. Yes, question.
First of all, thank you very much. Very good information. You spoke a lot about recognizing married couples and the types of effects it might have on their life. I just want to hear from you, what kind of symptoms that you can look for in teenagers, and B, on top of that, how exactly to find that line, the teenagers, because by teenagers, this pull is definitely much more.
Right. Okay. So just to repeat Rafi's question. The question was, maybe it's easier in some ways, and in some ways it is easier to recognize the problem in married couples because, right, once we're married, we're not supposed to be acting out. We're not supposed to have any kind of a sexual relationship with anyone except for our spouse, right? And by the way, I've heard from a lot of young men. I'm not like teenagers. I'm like guys who are looking to get married. That they only have this problem because they're not married yet, right? That's basically that. I'm not married. I don't have anyone for me to be sexual with. So until then, this is my sort of stopgap. Unfortunately, what they discover is that, as we said during the lecture, it's become a way of life. It's become a way of dealing with the hardships of being a human being, right? And that doesn't, as we all know, getting married doesn't make those problems go away. It very often just compounds them, right? Because now I don't have to worry about myself, and I have to worry about making me happy and making her happy, right? And then, of course, when I have kids, I have to make them happy too. So in answer to your question, though, I think it's really hard to know. Like if you are in a position where you can get to know that you're working with these teenagers and you can get to know them, I think the best thing is if you can. You may want to, and again, I guess talk to the Hanhala obviously about how this could be. You could broach the subject with them, and I don't know how young these guys are that you're working with, but if people think it's a safe place, then they're more likely to talk about it. In other words, as I said before, it's not just the guys who are failing. It could also be the guys who are doing great, right? They're just containing it better, and it could still be a problem. I remember when I was working at a clinic, there was someone who I worked with there. This was actually at YU, who came because he had the issue of pornography addiction, but they sent him to the female therapist because, there's a female therapist working there. He had no intention of bringing it up ever with her. And this is the whole reason he went to therapy. But once he saw that this is the therapist they gave him, he basically just talked about everything else and not about the one issue, right? I think that we, or you as rabbis, as people who work with people, you have the opportunity to show people that it's okay to talk about. Do you understand? And I actually, when I spoke to this therapist afterwards, because at a certain point I think he mentioned he had a problem, she kind of freaked out. She's a nice, frum lady. She was like, gross, go see Brad, right? When we're sending that message to these people, we're obviously saying she literally said, don't talk to me about it because I find it disgusting. You know what I'm saying? If we're saying that either actively or by omission, in other words, if we're saying you could tell me about anything, you got problems with this, problem with that, talk to me. But I'm not mentioning this other thing. And again, I think there's a way to do it in a way that's, sanua and, appropriate. You don't need to be graphic, right? Because if you're having problems with the internet, right, come talk to me, right? It's okay. You know what I'm saying? I know about this issue, right? We can talk about it. You're not going to get in trouble, right? But you should just know that if this is an issue, this could have really very serious repercussions down the line. And again, this whole rationale that people have sort of said, well, it's just at this stage in my life, right? Just because I'm 16 or I'm 18 or I'm 21, so it's okay. There's this whole issue now of people who and I saw this even when I was at YU, this whole generation of people who they went through puberty just as broadband internet was coming into popularity. So there was no such thing as sex without pornography. In other words, their whole introduction to sex with pornography, and then they later form relationships with women, and they're thinking, okay, well, this is exactly like what I've seen, right? Where this is what sex is going to look like. And it's basically about objectifying women. It's often about humiliating women. It's about using women, causing them pain. And now you want to have a relationship, right? Besides the fact there's nothing about talking, right? I don't have to talk to this person. This person's there to do whatever I want. Now when this guy gets married, imagine the problems he's going to have, right? Marriage is hard enough without that kind of programming beforehand. Okay.
So beyond that,
yeah.
Let's say I have that dialogue with a teenager. How can I tell whether this is a normal teenager problem or whether it's?
Well, I think certainly.
A lot of teenagers
right.
are definitely viewing it.
Yes.
It's definitely something that's normal and not an addiction.
Right. So I think definitely frequency is part of it, and I guess if you could look into also what role it's taking in their lives. You understand? And it's very easy for someone to get hooked on this because it's a way, like I said, to make you feel better for even just a few minutes or a few hours, right? So it's you want to look at that thing, and again, if they can talk also about how they feel about it. You know what I'm saying? If it's a sign for them, if they want to stop and they can't, that's also a really good indication that it's beyond a normal. I don't know if there is such a thing, by the way, as a normal amount of pornography or a healthy amount. No, I'm very serious. You know what I'm saying? This whole idea of the people who are casual users, I'm not even really sure to what extent that's really possible. Rabbi Haber.
Just curious, from a secular point of view, is this as much of a problem as it is with you?
100%.
But why? In other words, if you're talking about adult pornography, you're not hurting anybody. You're not. Maybe it's unhealthy for you. It's not like drug disorder or alcoholism.
Right.
You're going to drive and kill people.
Right.
It's not like overeating where you're going to get a heart attack. But why are they
Right.
concerned about it?
Right. Okay, so just to repeat the question. So is this as much of a problem with secular or non-Jewish people? And when I was in Manhattan, half of my clients were not Jewish or not from. So first of all, it's not just a thing that from women, find this as an act of betrayal. You know what I'm saying? I was actually very surprised. I remember I once had a woman come in and she had tattoos and a nose ring and this is her boyfriend. Her boyfriend was a comedian, and without getting explicit, basically they had done things together that I thought were pretty crazy, and she was fine with that. But him doing this stuff when she wasn't around, she felt was a major betrayal. So in other words, it's not just a from idea, this idea of betrayal. But on top of that, when a person is addicted to anything, they're not present, right? They're not really there. And this is, by the way, when people call me up and say, we want to do couples therapy, we can't do couples therapy. I say, we can't do couples therapy until the guy has the addiction under control. Because when someone is actively addicted, and this, by the way, this goes back to what I said before about if you deal with couples who are having marital issues, if you send them for couples therapy and he has an active addiction, it's not going to work. Because it's the equivalent of imagine this guy's having an affair, and now you're sending them to couples therapy, and it's the man, the woman, and the affair partner are all sitting in the room, and you're wondering why it's not getting better.
But addiction unto itself is not. I mean, I'm addicted to coffee, but it's not
Well, okay,
it's
so
not a bad
right,
thing, I don't
so coffee, whether it's really addictive, you know what I'm saying? I mean, there's definitely some withdrawal there, but again, same thing with Facebook and these other questions. Like this kind of addiction is much more similar to like a drug or alcohol addiction that it can really ruin your life, right? Just because people don't smell it on your breath and you're not going to be drunk driving, it absolutely affects people's ability to have an interpersonal connection. You know what I'm saying? And the wives and partners will pick up on that, because the partners won't be there. You know what I'm saying? Yes.
I mean, I work with, yeshiva age kids, so if they're...
With what?
Yeshiva age.
Yeshiva age?
Yeah, after high school. So if someone's not ashamed, they talk about it, but
Yeah.
they're doing it all the time, is that considered an addiction? I mean, they talk about it amongst themselves, they're not married. How do you, in that kind of situation, I guess it's kind of a mature question, how do you know if it's an addiction or just, they're not embarrassed, they all do it, like...
Right, okay. So the question is, again, what if you're working with teenager kids, and in that cultural setting, it's okay to talk about the fact that, hey, I watch porn, you watch porn. Hey, did you see this? Maybe they're sharing clips with each other, saying, how do you know if it's a problem?
More than just
Again, I would do the same thing that I said to Rafi before. Just the fact that people are comfortable talking about it does not mean that there's not an issue, right? We have an issue in our larger culture that it seems to be okay, right? It seems to be, I'm saying if you look at like the Western culture, the American culture, that like it's, people can be very open about that and not be embarrassed that, they're looking at pornography or, it's like even sharing them, watching it together. That doesn't mean there's not a problem, I don't know if that answers your question.
What should you do about it? I'm saying, how do I know that this guy's having a problem, but this guy just will watch it occasionally? Meaning, where's that line that this guy really needs help?
I think that's where you have to be able to, you have to have relationships with these guys. You know what I'm saying? You have to know what these, and when you get to know them. By the way, one indication, which is very interesting, and don't go too overboard with this, but one indication of someone who has this issue is someone who seems to bring it up a lot, right? In other words, like I know people, even guys in my shul, who are always making sexual jokes, right? And not in the middle of davening or whatever. But I'm saying, guys, it seems to be every joke seems to go back to sex, right? That's often an indication that someone is very focused on this thing, right? In other words, you may say, hey, what's so I'm just joking around. But again, it's not, for sure not. I'm not saying anyone tells a dirty joke is a sex addict. I'm not saying that at all. But I'm just saying that people who are sex addicts tend to sexualize everything. Everything sort of goes through the lens of sex, right? Things that are very innocent, right? They could see a tree that reminds them of sex, right? They could see, a design that reminds them of sex. Jokes, things that come up in conversation, like, oh, that reminds me, So that it could be an indication there's something there. But the only way you're going to know is if you have that relationship, someone feels safe. And like I said, you may need to talk to them. I don't know what your role is in yeshiva, but to talk to them and let them know that it's a safe place. But again, teenagers, they may not realize, especially if they're in a culture where it's okay, right? And they're kind of taught this is what boys do. They may not realize they have a problem until it's too late. Yes? That it's not enough to have a filter? It's not enough to have... It's not enough. It's sort of like, I've had clients say to me when I tell them they need to put filters on all their devices, they say, well, that's a crutch. What good is a filter? It's just a crutch. And I say, when someone has a broken leg, you need a crutch, right? People who have this issue, they absolutely need to have a filter. The filter is, but it doesn't solve it, right? In other words, if you don't address what's going on underneath, they're going to find other ways to access their pornography, right? And they may actually, the risk taking may go up. Now they're actually borrowing. I've had clients who would steal they'd wait till their roommate fell asleep and use the roommate's phone, right? Because they had a filter on their phone. I'm talking about guys in yeshiva, right? And I'm using my, right? I had a client, he actually climbed out the window to get into his brother's room. He had to go out the window and come into another one to get in his brother's phone when his brother was sleeping. So it's not going to solve the issue. But that doesn't mean that it still needs to, you need to sort of plug that leak. You need to make sure that it's not coming in through there. Does that answer your question? I'm sorry? If someone has a real issue, I don't know of any other way to deal it besides therapy. Like I said, I think 12 steps is great. I think 12 steps in therapy is probably the best combination. Yeah?
When you say 3 to 5 years, what do you mean? What's part of that process? You're talking about being in therapy for 3 to 5 years, you're talking about going to meetings once a week? Right.
So I'd say it includes everything. But I'm not saying someone needs to necessarily be in therapy for 3 to 5 years. It could be that they'll be in therapy for a year or two, and then they could continue more in the 12 steps. I'm not saying they need to be in therapy every week for 3 to 5 years. But I'm saying 3 to 5 years is sort of a rough amount of time that it takes for people to really fully recover. Right? This whole process, again, it's not about stopping the behavior. Stopping the behavior, that's when you can just start to get better. Right? As I was saying before about doing couples therapy with another woman in the room, getting someone to stop the behavior, that's the precursor to therapy. In other words, what I mean to say is it's a precursor to making changes. Right? It's sort of like sur meira ve'aseh tov. Before we can aseh tov, we need to first stop that other stuff. Because if you're continually getting more and more of the drug, right, which is what it is, we can't change anything. As long as you're still taking the drug, we can't change anything. So the first step is getting you to stop, right? And once you can stop, now we're going to focus on actually making the deep changes that are going to make it so that you don't need this anymore.
Even though he remained an addict.
Exactly. Even though someone is, the way we understand it, an addict for life. Okay? Yes?
Can we step away from the sexual issue for a second? It seems to me that there's a whole generation today that is basically addicted to their smartphone and addicted to the internet. And a certain percentage of them are going to slide into the lowest part of that, which is the subject of this talk. And almost by definition, they're going to end up in the sewers of it. But the beginning part of it is that they're just addicted. They can't put down their phones. For some people, especially on Shabbos, we're hearing about all these things. Even for like the menagerie, whatever. So it's like the beginning parts. Like, how does one deal with that general thing that, like, a typical teenager today?
Yeah.
You tell me if I'm right. It seems like a typical teenager today would qualify as being addicted to the smartphone.
Right.
They can't.
Right.
They can't talk to you without it. What do we do about that beginning?
Yeah. Well, I think it's definitely sort of a parenting issue as well as a cultural issue, right? I don't know that teenagers are worse than adults. I remember, I don't see it so much here. But I remember, like, back in my shul in Muncie, and this has nothing to do with Muncie, I'm saying, I don't know if this is an American thing versus Israeli, but Chazaras Hashatz, there was no one who wasn't on their phone. You know what I'm saying? Like, and again, maybe it's true in different communities here too. There was no one who was on their phone. So I don't think it's a teenage issue. You know what I'm saying? And by the way, I think the damage that's being done to kids by having parents who are completely, is huge, and we're not going to see it for a long time. But basically this idea that, I can't be available to you because I'm basically on my phone causes tremendous damage to everyone around you, especially kids, because they're growing up and this is all they know, right? But I don't know if parents need to give their kids smartphones. I know it may sound crazy, but I'm saying it depends what circles you're in too, right? I'm saying in Haredi circles, obviously no one's giving their teenage kids smartphones. I think even in the modern world, unfortunately one of the bad things that came out of, there was that big Asifa that happened in New York in MetLife Stadium, wherever it was, is they made this into a Haredi issue. In other words, like, and there was this whole thing in like the more modern world, it's like, these Haredim are nuts, like they want to live in the past, right? Internet's here, the internet is real, it's part of our lives, we're not going back, right? And I think there was actually someone in the Merkaz, I don't know if you guys saw this, someone with a loudspeaker yelling about, there is no life without internet, and like loudspeakers and banners, like internet is terrible and going to hell and all this. And the problem is you're turning people off. So I think you have to really be able to talk to people, meaning your kahilas and your kids and yourself, in ways that this isn't about fire and brimstone. Maybe that also, but that's not the issue. The issue is, can I have a full life if I'm glued to my phone, right? What am I missing out on, right? Those teenagers who are growing up with their smartphones a lot of stuff is coming out now. They're growing up without social skills, right? It's much easier, this whole thing of cyberbullying, right? It's very easy to bully someone when you don't see how it's affecting them, when you're not face to face, right? I could say, I hate you and you're a whatever, and I don't have to worry about, I'm not getting any feedback from you how this is hurting you, right? Same thing with relationships. Now they have all these apps for dating. I don't actually need to talk to anybody. I just click on someone, they click on me, and great, now we meet up, and there's definitely huge elements to our human nature which is suffering because of this, and I think we are addicted. But again, addiction, as Rabbi Haber says, is addicted to coffee, right? People are addicted to their smartphones, but it doesn't have the same kind of consequences as people who are addicted to these other things that we're talking about in this lecture. Okay? Yes?
You mentioned that the addiction is not necessarily, it's not the sexual part, it's more they have pain trying to numb the pain.
100%.
So would you say then that one is, if the same person would drink, he'd also become addicted to alcohol? Because I'm sure alcoholism also is
Right.
people numbing
Right. So I think, right.
themselves.
So the question is, why does one guy get addicted to alcohol and one guy gets addicted to cigarettes and one guy gets addicted to overeating? And I don't think anyone knows that. There's definitely, as I said before, there's a different profile for it, right? Some people take the drug to get high. Some people take it to block the pain. Some people take it to leave reality. Other people actually do it as a way of feeling deprivation. So, yeah. So.
Say though that let's say you take someone, now maybe you'll argue that no one doesn't have trauma in their life, even if it's a little team. But would you say if you take someone who doesn't have trauma, and then they fall into, obviously we don't want anyone looking at pornography at all, that, it's us. But if you take someone and they will start looking at it experimentally, then they really shouldn't become addicted to it. It will be something they
Right,
should be doing, but
right.
they're not addicted to it.
Right, and there is a school of thought that pornography addiction is different from other types of sexual addiction, in that there's something inherently addictive about as I mentioned, there's an inherently addictive aspect of the pornography, this sort of a super normal stimulus, right? So that even people who don't have that trauma can get addicted. I've never seen it. And I know that, that's sort of an official party line, that there is that type of, I've never seen someone who comes in with only pornography who doesn't also have significant trauma. So,
What percentage of women, is it the same percentage of women and men that get addicted to pornography?
No,
Or it's much
no, it's something about, it's like about 3 to 1, men to women. About 25% of people with this issue are women. Also, women who have this issue, usually it's a whole different ball of wax. It's a whole different picture from a psychological point of view. Why women get addicted to this is often very, very different reasons, and they have a very different psychological profile. But it is an issue for women too, and I have worked with women who have this issue as well. Okay, one last question, and then we'll wrap up. Okay, yeah. And then I'm available for questions afterward. But yeah, we'll take this last question, and then we'll let everyone go.
I just want to ask you, spoke about one of the sources of the potential trauma that can cause the addiction as a lack of connection in a person's life in general between his parents or between.
100%.
So if you have a boy with social issues who has trouble connecting to people in general, whether it's because of autism spectrum or whether it's because of other sorts of things, even though there are healthy connections going on around him, would he still be, a prime candidate for?
For sure, yeah, for sure. Someone. So just to repeat the question, does someone who has his own issues with difficulty connecting with people, is he more likely to have this problem? I mean, absolutely. Someone who, yeah, because basically it's sort of what people are after here is sort of a facsimile of connection, right? People are drawn to this because it makes them feel as if they're connected to someone, right? Someone. I mean, I could sit here and tell you stories and stories of just crazy stories of people who just, they were not able to find that connection in their lives, and so they often turn to these very inappropriate sources of connection, whether it's with people who weren't really appropriate to them. That's very common. People who, let's say, you're having a relationship with someone who lives in a different country, right? Someone's having a relationship with, God forbid, a married woman, right? Or someone who is too young, or someone who's not Jewish, or someone who's, all of these things. It's really not different than having a relationship with someone who's not a real person, someone who's on a video, because you're basically, it makes you feel connected, but they're connections which are by definition impossible to really be intimate with this person. So they're drawn to connections with people who are not there's no possibility of having real intimacy, because real intimacy scares them, because they grew up without intimacy. They grew up feeling very alone, very separate. They didn't see people connecting. They didn't see people with that kind of loving connection, or yeah. All right. So thank you very much, everyone, for coming. I'm available for questions privately if anyone has any other questions.